Hi, my name is Abby. I'm going to be your nurse. Go ahead and sit down. So at this moment, I would be providing privacy for the patient, performing hand hygiene. And sir, how are you doing today?
Doing good.
Awesome. Can you tell me your name and date of birth?
Gabe Falcone, 4/20/01.
Now, Gabe, what day of the week is it?
Wednesday.
And who's the president?
Trump.
Awesome, you passed. So today we're going to be doing a full head-to-toe assessment, and we're going to start by taking your vitals. So can you lay back for me with your head on the pillow?
Yes.
Okay, so I would start by taking the patient's blood pressure. Since I don't have a cuff, I'm just gonna wing it. So I would start by putting the cuff around his left arm, secure it, and I would line it up with his brachial artery. There we are. So when I have a cuff, I would put the stethoscope here, inflate, 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 watch the numbers go down, and record the reading. Next, I'm going to start looking for your heart rate. So for the patient's heart rate, I would find it here. And can you put your arm across your chest for me? So I would feel that for 30 seconds and multiply it by 2. And while I'm doing this, I would also look for the patient's respirations without telling the patient so that he doesn't mess it up. And it would be 30 seconds times 2. All right, your pulse is normal and your respirations are even, which is great. The appearance of the patient is very calm, no anxiety, no pain or anything, so that's good. His level of consciousness is alert and orient times 5. His position and posture, he is horizontal, laying down. Mood and affect, he seems almost bored, which is okay. It's better than anxiety. And as far as mobility and gait goes, I saw him walk in. There was no pain, no stiffness when he did mobility, so his mobility is good. All right, sir, I'm gonna have you sit up for me. We're gonna check your pupils. All right, so when we're doing this, we're looking for perla. So, okay, so look at me, please. Okay, so pupils are both round, they're both even, and we are going to check how reactive they are. So I'm going to shine this light in your face. Look at me. Perfect. The pupil moved from 5 millimeters to smaller, which means that it's reacting good to light. Now we're going to test their accommodation. So I'm going to need you to look over my shoulder, and then when I tell you to, you're going to look at my finger. Okay? Now. Good. The pupils also reacted good to accommodation, so there's nothing wrong there. All right. Now, sir, we're going to move to the head and face part of the exam. So I'm just going to feel around in your scalp, and I'm just going to be looking for any masses or lesions. All right. No masses, no lesions. Hair is very thick and not thin, nothing falling out, no dandruff, nothing of that nature. Okay. Now we are going to test your facial nerves. So I'm going to give you some commands and just do what I say. So smile, frown, frown.
I can't frown.
that works, that face works. All right, close your eyes tightly, open them quick. Very good, facial nerve is fine. Now I'm going to palpate your temporal artery. All right, so palpated their temporal artery. It's bounding, it's full, and there is no strange rate. Now I'm going to palpate your temporomandibular joint. So can you face me? So I'm just going to put my fingers right here. I need you to open and close your mouth. You do that one more time? Okay, I'm going to do this one more time, but now I want you to move your jaw like this. Side to side. Okay, no crackles or anything when he moved side to side, but when he opened his mouth, there was a small crack on his right side. Have you ever noticed that before?
A couple times.
Couple times? Okay. Now, I'm going to palpate his maxillary and frontal sinuses. So, excuse me, I'm just going to move your hair back. Okay.
It's not going anywhere.
Okay. All right, so now I'm going to palpate his frontal sinuses and his maxillary. Sinuses are not enlarged, which is good. All right, so now we're gonna get your ears. So I need to inspect the patient's ears. Can you straighten your head? There you go. So ears are both symmetrical. One isn't higher than the other. So now I'm gonna palpate your ears. Okay, skin is intact. There's no masses, no nothing, which is good. Now I'm gonna get his mastoid process, which is back here. Okay, there's no masses, no lesions, nothing. Together. All right, now I'm gonna head to the otoscope part of the exam. So normally I would have a machine, like we all know what an otoscope is. So can you get this with me? Yes.
Do I need to be on you or on him?
I want you to see the, I want you to see the ear.
Okay.
Okay, so I would take the ear, pull it up and back, and I would look in the ear, check his tympanic membrane to make sure that there is no scratches, no lesions, no inflammation, or no wrong color. I am also looking for the amount of what we would call earwax would be in there, and to see how much he has. Now we're gonna move on to your nose. So I'm gonna inspect his nose. It is midline, doesn't look anything out of the ordinary, which is good. Skin's still intact, which is good. Now we're gonna test the patency of your nares. This means I'm gonna pull down one side of your nose and I want you to sniff it in, okay? Sniff, good. Sniff, good. Okay, both sides went down, perfect. All right, so now this would be the speculum exam. So now I would look in his, no, you're good. I would look inside his nose and I would just inspect if there are any masses, any lesions going on in there. And yeah, I don't have one, but that's okay. All right, so now we are going to inspect his lips, cheeks, and I don't have a popsicle stick. Okay, so we are going to move forward a little bit and we're gonna skip to your neck. We'll come back to this. So can you look up? Okay, take your hand down. So I'm gonna be looking at his neck, midline, no lesions, no masses, nothing out of the ordinary that I can see. So now we're gonna do some range of motion. Okay, so can you put your chin to your chest? Good. Now can you extend backward like this? Good. All right, now can you bring this ear to your shoulder? All right, now bring the other ear to your shoulder. All right, now can you look side to side? Good. All right, any pain or tenderness while you're doing that?
No.
No? Perfect. Okay, now we're gonna test your muscle strength. So I'm gonna apply some resistance here. Can you stand up straight for me? Okay, I want you to shrug your shoulders up against this. Do it again. Good. Okay, now I'm going to palpate your trachea. So I'm just gonna, trachea is midline, which is great, that's what we're looking for. Now we are going to head back to the patient's mouth and throat. Okay, so, thank you. Gums are good and pink. Teeth is intact, he has a retainer in, but that's fine. Sorry. Gums are good all the way around. Teeth are intact, which is great. Now, I'm gonna inspect and palpate your throat. So throat looks good. Palpate this a little bit. Good. Now, open wide. Yeah, say ah. Good. Tongue is fine. Now I'm gonna take a look at your, I'm gonna take one more look at that because I need a light. So, perfect. So I'm gonna stick this on your, close your mouth. I'm gonna stick this on your tongue. I want you to say ah for as loud as you can. I'm just gonna see what's going on. Perfect. Tonsils are good. They're not enlarged. Pharyngeal wall is moving great. At this point, I would test his gag reflex. So I would take the popsicle stick and touch the back of his throat and see if the gag reflex is there. Okay, now we are moving on to the thorax and lung. So I'm just gonna take a listen. So what I need you to do is I need you to turn around, and can you take your shirt off?
Of course.
Got it. Okay, so I would inspect and palpate the posterior part of his back. So, not feeling any masses or lesions. There's nothing out of the ordinary. Now, can you breathe in and breathe out? Good. Symmetric expansion was good. One side wasn't moving higher than the other. Now we are going to take a listen to your breath sounds. There are 18 sounds total. So I would ask him to listen for a full breath on each side. Breathe in, breathe out. Good. Breathe in, breathe out. Good. Breathe in. Good. Good. Breathe in. Good. 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 You need a break?
No.
All right. So that was an example of how I would auscultate the breath sounds. I would hit 18 total places. Now I'm gonna have you turn around to the front. Good. So now we would inspect and palpate his anterior. So with what I'm looking at right now, it seems pretty even. The only thing, can you put your hand down, please? The only thing that I'm seeing is that one of his shoulders seems a lot bigger than the right one. But other than that, nothing else. All right, so stand up straight. So palpate. No masses, no lesions, skin's intact, which is good. Okay, the rate and rhythm of his respirations are even. They're not too fast, they're not too slow. Now, we are going to do the same thing that I did to your back. So breathe in, breathe out. Both good symmetric expansion. One side did not go higher than the other, which is great. Okay, so now there are 10 total spots that you would hit while doing the anterior. So we're gonna do a little example of listen for a full breath. So start up here, breathe in. Good. 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 Can you do one more? Good. He was good on inspiration, a little diminished on expiration, but that's okay. All right, so now we are going to get to your heart and neck vessels. So now I would start doing his apical pulse. So can you sit up straight for me? The apical pulse would be located down here. Good. Now with that, I would listen for a full minute, and the S1 sound on that one is definitely the loudest. All right, now we are going to listen to a couple spots on your chest. We're just gonna listen to your heart for a bit. I'm gonna hit 5 spots in all. S1 sound was the loudest there. S1 sound was the loudest there too. S2 sound was loud. S1 sound. Can you sit up? Thank you. And the S1 sound was the loudest there. The rate is steady. It doesn't sound slow or too fast at all. The rhythm, it's going at a thunk, 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 which is what we want, which is good. All right, now, can you tilt your head up? I'm gonna palpate your carotid arteries. So I'm gonna go here. All right, it's good, it's bounding. This side is bounding too, and they're both going at the same rate and rhythm, which is good. All right, so now we're gonna inspect your JVD, which is your jugular vein distension. So I'm gonna need you to lie flat. Okay, so, all right, look at me. Sorry, I didn't mean to tell you to do that. Look straight up so I can take a look at your neck. Okay. I'm not seeing them go out, which is good because I doubt that you have corneal coronary artery disease. I'm gonna take a look on your other side to make sure that it's good. It's not sticking out, which is good. All right, you can sit up. All right, actually I lied. Can you lay back down? I'm gonna get your abdomen. All right, so I'm just gonna inspect your abdomen for anything out of the ordinary, which looks like nothing is. Your skin's intact. I don't see any masses. I don't see any obvious lesions. Your umbilicus is midline, which is good. And you are an innie. Yes, you are. Okay, so now I'm gonna take a listen to your stomach sounds. So I'm gonna hit all 4 quadrants. Start here. Good. 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 Sounds were good. First quadrant, third quadrant, fourth quadrant, a little low here. Okay, so now I'm gonna palpate your abdomen. I'm gonna use light palpation here. Okay, good. Nothing that I felt was weird. Now we're gonna do some deeper palpation. So I'm gonna go in deeper. Good. Now, was there any pain or tenderness when I did that? Good. Okay, so now we are going to get his neurologic. So I observed his gait when he walked in, and he was walking fine. There wasn't falling over. There's no pain, no tenderness, which was good. So, but now we're gonna do some fun tests. So you sit right here. Okay, so I'm gonna give you a beat to do. I don't need this anymore. And I want you to repeat it. So. Good. Now I want you to keep on doing that faster and as many times as you can. Good, good. Yeah, the rhythm was fine. He stayed in perfect rhythm the whole time. There was nothing strange. It was good. Okay, so now we are going to do a fun, here we are. So I want you to close your eyes and tell me when you feel this sensation. Okay.
Got it. Yep. Feel it. Right there.
Good. Okay, so he felt pain. Well, he definitely felt the touch every single time I administered it. He even felt it before I even touched him in this hand, which has gotta be a record. But yeah, he passed pretty well. Now we are going to do something called a 2-point discrimination test. So I need you to close my eyes and I need you to close your eyes and tell me if you feel 1 point or 2 points.
All right. 2. 2. 2. 1.
Okay, good. You definitely felt which points were 2 and which points were 1, which is very good. Okay, now we are going to hit your patellar reflexes. So I brought a chair for you. Sit right here. Since we don't have a little hammer to hit them with, this is gonna have to work. So I'm just gonna test your reflexes. There we are. Good, good. Now we'll need you to lay back here so that I can get the rest of the reflexes. Okay, so I'm going to put my hand right here. Okay. Good. All right, now I'm gonna place my hand under here. All right, good. Move there. All right, now I'm gonna need you to, your foot, I'm gonna need you to point it outward for me, okay? Okay. Good. Good. All right, now place this other one out. All right, a little more diminished than that, but that's okay. Now, I want you to cross your legs. Good. And I want you to point this foot out a little bit. All right, good. Now cross them again. All right, good. All right, that's good. And on the reflexes, his patellar reflexes were good. Some places were more diminished than others. Now we're gonna get your muscle symmetry. So you stand up. Okay, so what we're gonna be looking at is if anything, if there's any atrophy, if anything is more built up than the other. The only thing that I can visibly see right now is that his left shoulder is bigger than his right, but that's okay. Okay, so you flex for me. Okay, good. Now flex for me down here. All right, now stand on your tiptoes. Okay, everything was symmetrical. Patient obviously feels really good about his muscles, that's fine. No atrophy, no lesions, and this concludes our head to toe assessment. Thank you.
You're welcome.
You can end it.